Let's take a look at this question. A 73-year-old woman is brought to the physician by her daughter for evaluation of impaired memory and word finding difficulty for the last 2 years. She was recently asked to step down from her position as volunteer accountant for a local charity organization because she is no longer able to coordinate her tasks. She reports that she has become unable to taste or smell her food. 2 years later, the patient dies, and at autopsy, examination of the brain shows, very important, generalized cortical atrophy of the brain. A photograph of a section of the brain is shown. The inclusions indicated by the arrows. The inclusions indicated by the arrows are predominantly composed of which of the following substances? So, in this question, we have got memory deficit, we have got amnesic aphasia, where she is having word finding difficulties, the impaired memory part, then unable to taste or smell the food. Taste and smell, they go together. When we are able to smell anything, that contributes to the taste also. So we have got hypoosmia that led to her hypogeusia. Because she is not able to smell, she is not able to taste also. Just like it happens whenever we get like common cold. We find all the food very bland because we are not able to smell it properly. Then the most important clue that they have given in this question is the generalized cortical atrophy. All of these things, they lead us on to, what are we dealing with? Alzheimer disease, right? Now, they are asking us, whatever we are seeing in these images, that these arrows are pointing at this and this, these structures, these are some kind of inclusions. What are they composed of? And that brings us to our options. First of all, we have got alpha-synuclein. Now, since we are dealing with Alzheimer's, what we should know is that alpha-synuclein is basically going to compose your Lewy body. Lewy body can be found in 2 diseases. Lewy bodies are composed of alpha-synuclein, and this is found in 2 diseases. One is Lewy body dementia and the other is the Parkinson disease. Now, if the person was to have, let's say, Lewy body dementia, they would definitely get some kind of REM, sleep behavioral changes, right? They'll get some kind of sleep disturbance. And another thing very important for Lewy body dementia is visual hallucinations. These people get visual hallucination. But if we were dealing with Parkinson disease, we would get the whole trap thing: tremor, rigidity, akinesia, and postural instability. None of these things are seen in this question. So the thing that we are dealing with, it is not alpha-synuclein. In this image, it's not alpha-synuclein. That brings us to the second one, which is the viral ribonuclear protein. When they say viral ribonuclear protein, what they're essentially trying to describe is the Negri bodies. And where do we find Negri bodies? Yes, we find them in rabies, right? So, viral ribonuclear protein is the option for Negri bodies and rabies. And we are very clear on this, that this is not a question dealing with rabies at all. Because if it was rabies is such a lethal disease. We are going to find not gradually progressive dementia, the person would be dead within days to weeks. It is very lethal disease. We will not have gradually progressive dementia. In this case, impaired memory, word finding difficulty for 2 years. It won't be like this. It won't take that much time. But yeah, Negri bodies we must know are for rabies. And what are Negri bodies? They are round intracytoplasmic inclusions in the Purkinje cells of the cerebellum and hippocampal neurons. So that brings us to our next option, which is amyloid B. What happens in Alzheimer's patient is that on chromosome 21, what happens is that these people, they express amyloid precursor protein. Because of chromosome 21, we get amyloid precursor protein, which that converts into beta amyloid. This beta amyloid is going to form senile plaques. What kind of disease are we talking about? We are talking about, again, we are talking about Alzheimer's only. Alzheimer's only we are talking about. In Alzheimer's, there is amyloid precursor protein which converts to beta amyloid, which forms senile plaques. So this could as well be senile plaque. So why is it not senile plaque? Because the bodies that we are looking at, they are intracellular. They are intracellular inclusions. Whereas beta amyloid is a plaque. It is not an inclusion. It is extracellular plaque, not an inclusion. That is why in this question, even though amyloid beta is seen in Alzheimer's disease, what we are seeing in the image, however, is not amyloid beta. That brings us to the next option, which is hyperphosphorylated tau. So what happens is, tau is a microtubule associated protein. It is very important protein in preserving the cell structure. So if the cell structure is fine, its functions will also be fine. But what happens in Alzheimer's disease is we get activation of these kinases. Okay, so there is activation of these protein kinases, and they convert the good tau, the normal tau, into hyperphosphorylated tau. What we end up getting is hyperphosphorylated tau. This hyperphosphorylated tau, it forms neurofibrillary tangles. These neurofibrillary tangles, they impair the neuronal function, leading to neuronal death. Because of neuronal death, the patient of Alzheimer's, they get dementia. So tau protein is the normal one, but in Alzheimer's we get hyperphosphorylated tau, which forms neurofibrillary tangles. So what we are seeing here are basically neurofibrillary tangles. These intracellular inclusions are of hyperphosphorylated tau in the neurofibrillary tangles. So D is the correct option. What we are seeing in this image, the inclusions indicated are predominantly composed of what? So these are neurofibrillary tangles. The indicated by the arrows are the neurofibrillary tangles, and they are composed of, what is our D option here? Hyperphosphorylated tau. Then the last option here is about the prion proteins. Prion proteins are something we see in CJD, Creutzfeldt-Jakob disease, and in this we get plaques, and these plaques, they cause cell degeneration and neuronal death. But again, this patient took 2 years for the whole dementia and all that, and the death also occurred 2 years later. So it is a very slow progressive dementia, and the death also occurred very slowly. If we were dealing with CJD, what would happen is rapidly progressive dementia. In this cases, we get what? We get rapidly progressive dementia. Rapidly progressive dementia. Along with that, one very important finding is myoclonus. Myoclonus. One another thing that we find, we knew that we were dealing with Alzheimer's disease because in the question they had given us generalized cortical atrophy. Here they had given us generalized cortical atrophy, and we should know that in Creutzfeldt-Jakob disease, if you were to do the autopsy, you would form spongiform encephalopathy. What they get is basically in CJD, spongiform encephalopathy. Spongiform encephalopathy. So that's it about this question. We should know that alpha-synuclein is something that would be seen in Lewy body dementia, Parkinson disease. Viral ribonuclear proteins are for rabies, very rapidly progressive, so not the answer. Amyloid beta is found in Alzheimer's, but these are plaques and they are extracellular. They are not intracellular inclusions at all. These are plaques that we get, and so it's not amyloid beta. Then hyperphosphorylated tau, yes, in Alzheimer's. The normal tau, which is very important for microtubule, it is a microtubule associated protein preserving the cell structure. It is going to get converted into hyperphosphorylated tau by the activation of some kinases, forming neurofibrillary tangles that contribute to dementia by causing neuronal death. And prion proteins are for CJD, rapidly progressive dementia with myoclonus is seen in that disease. And on autopsy, we will not find generalized atrophy. We are going to find, if it was CJD, spongiform encephalopathy. Now, let's take a look at this image. What is this image depicting? The hint here is that this is again for Alzheimer's disease only. This is again Alzheimer's disease. So, we had discussed two things in Alzheimer's. One is the neurofibrillary tangles composed of tau protein, and the other is the amyloid beta plaques. Amyloid beta plaques. These are the amyloid beta plaques. These are the amyloid beta plaques. Okay. So we can see that these brown bodies here, this here is what the plaques would look like. Okay, let's quickly summarize Alzheimer's disease. So in Alzheimer's disease, a lot of proteins are abnormal. Because of some genetic factors, we get some abnormal proteins. So in patients with Alzheimer's disease, they have some abnormal proteins. Let's say there is abnormal ApoE2. Because of abnormal ApoE2, what they are going to get is decreased risk of Alzheimer's disease. So it's a good thing to have this ApoE2 protein because it is going to decrease the risk of your sporadic Alzheimer's disease. Then we have the ApoE4. If a person has got ApoE4 protein, then it is going to increase the risk of sporadic Alzheimer's disease. Then we get the next one, which is the amyloid precursor protein. So this amyloid precursor protein, it is found on chromosome 21. It is the one which contributes to this beta amyloid plaques and it leads to Alzheimer's disease. These plaques are found in Alzheimer's disease. This protein is responsible for Alzheimer's disease. Now, if a patient has got trisomy of the chromosome 21, like in Down syndrome, they'll get more and more expression of this amyloid precursor protein. They'll get more and more of beta amyloid plaques. So, patients with Down syndrome, they are at increased risk for Alzheimer's disease. That's a very important clinical implication in Down syndrome patient. Then presenilin 1 and 2, again these are responsible for familial form or early onset Alzheimer's disease. So basically in all these, ApoE2 is the one which decreases the risk of Alzheimer's disease. It's a good thing to have ApoE2, but the rest of the proteins, ApoE4, amyloid precursor protein, presenilin 1 and 2, they are all contributing to Alzheimer's disease. Then what are the features that we see in Alzheimer's disease? We have already talked about the neurofibrillary tangles. They are composed of hyperphosphorylated tau proteins. The more neurofibrillary tangles you will get, the more dementia you will get. They are directly proportional to each other. The more the neurofibrillary tangles, the more will be your dementia. Other than this patient of Alzheimer's disease, they have generalized cerebral atrophy. Cortical atrophy, when it occurs, especially in the hippocampal area, it is very prominent to get this atrophy. The sulci and gyri, they're going to change. The gyri are going to narrow. The gyri are going to narrow and the sulci around them are going to become wide. So because of this atrophy, the ventricles, they get space to expand and we get a type of hydrocephalus known as hydrocephalus ex vacuo. So we get a type of hydrocephalus in these patients because of the cortical atrophy. Other than this, there is Hiranopodies, which are intracellular eosinophilic proteins that are basically in the hippocampus. Not very important, but yeah, these are the important things related to Alzheimer's disease. The beta amyloid plaques are very important. The neurofibrillary tangles composed of hyperphosphorylated tau proteins are important. The fact that there is generalized cortical atrophy that happens leading to some kind of hydrocephalus because of the ventricles, they expand in the space that is now available for them. That is important. The proteins are very important. And that's it about Alzheimer's disease.